this is a very important proclamation and an important month, something that I don't think we focus enough on based on the prevalence. So I'm really happy that we're able to present this morning. We will hear from shortly Dr. Ikenna Myers, who leads a men's health program with HOC, our Housing Opportunities Commission, in partnership with the African American Health Program. We also have George McFarland, who leads the Brother to Brother Health Education Initiative for AAHP, and Arlie Wallace, who's the program manager for AHP, who are going to join us in just a moment and they'll make a few remarks. I'm wearing my sky blue tie. That's the color for Prostate Awareness Month, and all men are at risk of prostate cancer. It's after skin cancer. It is the most common cancer among men. Out of every 100 Americans, 13 will get prostate cancer during their lifetime, 13. And 3, unfortunately, will die from prostate cancer. The most common risk factor is age. The older a man gets, the greater the chance of getting prostate cancer is. The statistics for African American and Black men are even more alarming, particularly if there's a family history of prostate cancer. You're at increased risk of dying from the disease, and African American men get prostate cancer at a younger age, tend to have more advanced disease when it's found, and tend to have more severe type of prostate and aggressive type of prostate cancer than other men. It is a terrible disease that affects, like all cancers, every member of the family. I personally have been impacted quite a bit by prostate cancer. My father was diagnosed in 2011. I remember it like it was yesterday, sitting with him and the doctor, and the doctor advising him that he had prostate cancer, is something you never want to hear, a son never wants to hear. He was in 2011, he was 59 years old as we sat there, and fully healthy visibly on the outside, but had this cancer within him. The doctor had advised him to remove his prostate. They thought at the time, you can never be 100% sure, but from scans and biopsy, they thought at the time it was contained within the prostate, and they advised him to remove the prostate. He was worried about surgery. He was worried about some of the potential side effects. He waited about 11 months to make a decision. And by that time, unfortunately, it had spread out of his prostate into his bones, and it was too late to remove the prostate as a treatment. He did undergo treatment, and he lived for another 5 years and passed away in April of 2017. And it was a horrible, horrible decline for him. He lived with us for 4 years, and eventually he was paralyzed from the waist down, couldn't walk, and had to be cared for. Ended up in Montgomery Hospice, who did a great job. I tell that story in great detail because it's one of the most preventable cancers if you get screened and you get checked and you take action quickly. I think about often what would have happened if my dad would have taken action quickly and removed his prostate right away. He might still be with us today. I have an older uncle, his brother, who lives in Nigeria, who's 11 years older, who will celebrate his 80th birthday this December, who also had prostate cancer, but acted quickly and removed the prostate and is still with us. I have an uncle on my mother's side who has prostate cancer, who's going to be 85 this year, who acted quickly. So it's the point I want to underscore here today is that if you're an African-American man, if you have a family history, you need to get checked by the time you're 40. It's a PSA blood test you can do with your physical. It's very easy. If you're any other US man, American man, you need to get checked by the age of 50 to make sure that you can get ahead of this and know what to do early. And early detection is key, particularly with prostate cancer, but with all cancers. So I wanted to share that. I appreciate my colleagues' indulgence. We have a proclamation, but I want to turn it over briefly to Dr. Ikenna Myers and Mr. McFarland, if they have anything, and Ms. Wallace, if they want to briefly state about their work around prostate cancer awareness and what they're doing with the African American Health Program.
Thank you for inviting us. Again, my name is Dr. Ikenna Myers. I am one of the program managers along with Arlie Wallace at the African American Health Program. We do a lot of great things surrounding prostate cancer. Again, I want to reiterate, screening is key. At the African American Health Program, we do have several classes surrounding chronic diseases, and one of the things we do focus on is prostate cancer. I think that prostate cancer and screening is very important. We do provide referrals to African American physicians and practitioners to get screened, as well as we have a great class that we're in collaboration we're doing with the Housing Opportunity Commission surrounding men's health, where we focus on different issues of men's health, and obviously prostate cancer, testicular cancer are one of the main topics. It is a program for men in the age range of 35 to 55. And so we're really hitting the target and requesting that they get screened early. If you have some time, please visit us at HP, African American Health Program, montgomerycounty.org, or www.hpcovid.com to get information on COVID. Again, thank you guys for my time, and I want to pass it on to Mr. McFarland.
I'm not sure if he's with us today, so I think we'll go. Ms. Wallace, do you have anything to add?
Well, good morning. Thank you all, and thank you for inviting the African American Health Program to participate. I will not repeat what Dr. Myers has stated, but I will say that the African American Health Program has historically worked with Black men by working with our fraternity, Men's Health of Washington, D.C., to incorporate men's health, early screening in prostate cancer. We've also established a men's health program within the African American Health Subcommittee, and we're particularly trying to target to emphasize. Okay, but I thank you all, and hopefully we can continue to do the work under the support of the County Council and many others. Thank you.
Absolutely. Thank you, Arlene. I do want to point out that we didn't coordinate, but you all rightly wore your sky blue, your colors today. So between the two of you. So thank you for that. I'll read the proclamation. You can stay on for that. Whereas prostate cancer is the second most common male cancer in the world. It affects roughly 1.3 million people and kills more than 360,000 people each year, which represents about 4% of all cancer deaths worldwide. Every 3 minutes, a man is diagnosed with prostate cancer. And whereas in the United States alone, there will be roughly 248,000 new cases and more than 34,000 deaths in 2021. Prostate cancer, the 8th leading cause of cancer-related deaths, will impact an estimated 1 in every 7 men in their lifetimes. And whereas Black men are over 75% more likely to develop prostate cancer and more than 2 times more likely to die from it than males from other racial groups. They are also more likely to develop aggressive forms of prostate cancer. And whereas prostate cancer is the most commonly diagnosed cancer among Hispanic and Latino men in the United States, comprising more than 1 in 5 of all new cancer diagnoses, and contributing nearly 14,000 new diagnoses and 2,000 deaths annually. And whereas, according to the Prostate Cancer Foundation, it's important to note the stress of enduring racism and racist systems that may play a part in developing the disease beyond genetic factors. And whereas, screening may find cancer that is likely to spread to other places in the body so it can be treated before it spreads. This may lower the chance of death from prostate cancer in some men. And the American Cancer Society recommends that men begin talking to their doctor about prostate cancer screening at the age of 50. And men at higher risk, including men with a family history or Black men, should talk to their doctor and be screened at age 40. Now, therefore, be it resolved that the County Council of Montgomery County, Maryland hereby recognizes September as National Prostate Cancer Awareness Month, and be it further resolved that the County Council encourages all male residents of Montgomery County, ages 40 and over, to talk to their physicians about prevention of this disease. Presented on this day, the 14th of September, in the year of 2021, signed by myself, William Jawando, and our Council President, Tom Hucker, on behalf of the entire Council. So thank you all for coming, and thank you for helping to raise awareness and all the work that you do.